The Victorian Government has launched a major ad campaign urging people across that state to obey COVID-19 restrictions. The campaign goes to air as authorities warn restrictions could remain in place longer than 6 weeks if cases continue to rise. The death toll from coronavirus clusters at aged care homes is expected to surge, with more than 500 active cases in Victorian facilities.
Well, yesterday, 357 new cases and 5 deaths were recorded, taking the state's total death toll to 61. 3 of the 5 most recent deaths are linked to aged care outbreaks, and the federal government has announced the establishment of a Victorian Aged Care Response Centre to coordinate the effort to deal with the pandemic.
OK, well, our reporter Leanne Wong in Melbourne is standing by. And Leanne, tell us more about this advertising campaign that the Victorian government's running and why.
So the Victorian government's essentially ramping up its communication, focusing on real-life stories behind coronavirus, that we see the faces behind all these vast numbers every day. Now, we know that there are over 300 active cases currently linked to healthcare workers, and we hear from a number of hospital workers who are speaking to us, warning us to essentially or recommending that we follow the government's recommendations. We hear from an ICU director, and we also hear from a nurse who wants to remind Victorians that healthcare workers are the last line of defence, but the public is the first line, and is urging us all to stay in as well as wear masks. Perhaps one of the most confronting of the ads, though, is we hear from Michael, who contracted coronavirus earlier in the year. Now, he had to spend 72 days in an induced coma while he was trying to fight off the virus, and during that time, his wife also contracted coronavirus and likely passed it on to her elderly mother, who passed away soon after. Now, speaking yesterday, our Chief Health Officer, Professor Brett Sutton, says it's about communicating and bringing home the message that there are genuine consequences to this virus. And this ad campaign also comes after yesterday Premier Daniel Andrews posted on Facebook essentially asking young Victorians to also do their part to stay in and do the right thing. He wants to remind young Victorians that there are currently 8 Victorians under the age of 30 who are currently in hospital due to coronavirus, and 2 of those are children. And he wants to remind people that these numbers that we're seeing every day, that behind them there are real people and real Victorians who have been affected.
Well, it certainly seems like a full court press to encourage behavioural change. Leanne, what's been the response, though, more broadly, to the growing number of deaths that are clustered around aged care facilities in particular?
Yeah, the number of aged cases we're seeing linked to aged care facilities just continues to grow. And in response to that, the federal government has announced it will be establishing a Victorian Aged Care Response Team. Now, that will be based out of Victoria's State Control Centre, but it will be a coordinated effort with state and federal government agencies, as well as Victoria Health. Now, that will also include staff from the Defence Force, as well as Department of Health and the Aged Care Quality Control Commission. Now, Premier Daniel Andrews also spoke yesterday and said that the Victorian government is working with the federal government to also drive down chains of transmission found between workers who are working at aged care facilities. There are currently 536 active cases linked to aged care facilities. Of those, half are actually workers, and we know that a number of workers at aged care facilities work at multiple sites, and particularly casual workers. And the Premier Daniel Andrews says that he's trying to consolidate their shifts so that they work at single sites and aren't able to pass it on between multiple sites. He also referred to the fact that that personal protective equipment is compulsory, that there are visitor limits to aged care, and that there is asymptomatic testing for healthcare workers who work at these facilities. So a number of different measures that the government's trying to take.
And I imagine we'll hear more on those tactics and others in the government update from Victoria today. Leanne Wong, our reporter there in Melbourne, thanks for joining Weekend Breakfast for yet another update.
Well, that's Victoria, but authorities in New South Wales are urging people to be mindful of COVID-19 restrictions as the number of cases continues to rise in that state. 4 of yesterday's 15 cases have been linked to a woman who attended a number of church services in Sydney's southwest from the 16th to the 19th of July. Those who attended the services at St Brendan's Catholic Church, Bankstown, Osier Funeral Services at Fairfield East, and Rookwood Cemetery at Lidcombe have been urged to immediately self-isolate and to get tested.
4 additional cases of COVID-19 have been associated with a series of funeral gatherings and a church service. And New South Wales Health is calling on people across the state to redouble their efforts to stop the virus spreading.
New South Wales Police Minister David Elliott's appealing to people not to forget social distancing and face masks in weather emergencies. The warning comes as the Weather Bureau predicts significant rain across parts of the state in coming days.
In other news, the Queensland government has talked down the appeal of joining a travel bubble with Tasmania. In 2 weeks, a travel bubble will open between the Northern Territory, South Australia, Western Australia and Tasmania. But Hobart will not be opening the little state's borders to Queensland, the New South Wales or the ACT before mid-August.
Investigations are continuing into a crash that killed 3 women and a man, all aged in their 20s, in the Gold Coast hinterland yesterday. The car carrying the 4 young Queenslanders lost control yesterday afternoon and slid into the path of an oncoming ute. Paramedics couldn't revive the 4 occupants of the vehicle. The driver of the ute was taken to hospital with minor injuries.
Overseas now, and Spain is again tightening virus restrictions in the Catalonia region, including the city of Barcelona, as cases rise yet again. Yesterday, Spain had more than 2,000 new cases, bringing the country's total cases to 272,000. Nightclubs have been closed and cultural and sporting events suspended in an effort to stem the spike in cases. The UK government has announced all travellers from Spain will have to quarantine for 2 weeks and are advising against non-essential travel to the country.
Well, throughout the day, throughout the morning, we've been asking people to show us their creative side when it comes to face masks, because they're a feature of everyday life in Australia now, at least in parts of Australia. And what about some of the creativity that's on display, Fazia?
Isn't that fantastic? People have been cutting offcuts of old T-shirts or socks. Or I know there's a YouTube clip of how to make a face mask out of a sock. I think Bill Shorten tried that as well on TikTok, and it did work
with limited
quite well.
success, to be
That's true.
Very polite.
But look at all this amazing creativity. Listen, if you can't get face masks from the shops, from the pharmacies, you can always cut up some T-shirts, I suppose, old T-shirts, old shirts, old jeans, and just make your own face mask, whatever that can help protect you through this time as well.
Just about anything goes,
Yeah.
although I think there's a question mark about getting too elaborate with breathing holes and that sort of thing. Stop short of that one, please.
Yes. So thank you so much for sending in those pictures. We really do appreciate it. Actually, there's just one last one we want to show you. We've been told that there's a very particular one that's been sent in that's quite interesting. One about a beak. Oh, there you go.
Looks more like a World War I
Yes,
gas mask.
It does. It does. It looks like a... Do you remember those Mad magazine? Remember that Mad magazine? There was a character that looked like that. I think there's another one too with a hat as well. Of course, if you've got a lovely mask, why not accessorise with a lovely hat as well?
Fully colour coordinated.
Yes, absolutely. Thank you so much for sending in those pictures. We really do appreciate it. Love hearing from you all the time. Now we are going to pivot back to the news at hand, and we're going to talk about the death toll from coronavirus clusters that are at aged care homes in Melbourne. And these numbers are expected to rise with more than 500 active cases in Victorian facilities. Meanwhile, authorities in New South Wales are urging people to be mindful of COVID-19 restrictions as the numbers of cases there continue to rise in Sydney.
Yep, and the Deputy Chief Medical Officer, Dr Nick Coatsworth, says Victoria's efforts to control these clusters in aged care homes do require a flexible approach.
The first thing to say is that the Commonwealth and the Victorian governments have been working for many weeks now on controlling COVID-19, both in the community and the aged care sector. This is very clearly a response to the increasing numbers across Victorian aged care, numbers that are concerning, numbers that demand an enhanced response in the form of the Victorian Aged Care Response Centre. This is about ensuring that there is an appropriate emergency management structure so that there's excellent coordination of things like workforce distribution. It's very challenging when many staff can be off home, isolated with COVID-19, to provide enough staff for aged care facilities. And that includes kitchens, meals, all the things that you would need to run an aged care facility, the sort of logistics support that we need to implement when there are, as you say, over 500 cases linked to aged care facilities in Victoria. So that's the purpose of the Victorian Aged Care Response Centre, to provide that very clear coordination for the response to ensure that we protect residents and their families.
What are we to conclude, Nick Coatsworth, about the protection that are in place, protections that are in place, both for aged care staff but others on the front line, health workers, because it's a very high number running in Victoria among professional staff, 313, plus I think one member of the military. I guess these aren't preventable, but should and could that number be lowered?
Well, Greg, there's some really important things to emphasise here, and that is that when you have community transmission, to the extent that there is in Victoria, we mustn't assume that every healthcare worker or residential aged care infection is due to acquisition in the workplace. In fact, the opposite is true. The majority of cases are those that are acquired by a healthcare worker or residential aged care worker in the community. So it is as important. It's a two-way street, really, that healthcare workers, aged care workers need to wear the appropriate protective equipment when they're dealing with patients with COVID-19. But we must, and as a doctor I can completely support this, be very cautious about our own contact with COVID-19 and make sure that we all stay at home if we're at all unwell and get tested.
So the popular interpretation that would obviously leap to the conclusion these must have been somehow acquired at work or related to work, you're actually saying there's evidence to suggest that's not the case in these 313?
I am certainly suggesting that. I'm suggesting that it's a two-way street, as I said, that equally you can acquire, being a healthcare worker or a residential aged care worker doesn't stop you from acquiring COVID-19 from friends or family, or indeed people in the tea room. Yep. So we have to make sure that we protect ourselves as much as we can. But this is also a call to have these cases investigated as quick as possible, and that's something that we're certainly looking at the highest level, so we can get that information out to healthcare workers and residential aged care workers and to patients. OK,
mask standards, Nick Coatsworth, obviously they're compulsory in some corners of our nation, but being adopted elsewhere, generally, what should people be looking for here, including the question of those inserted valves? Are they healthy or not?
Well, look, Greg, there's a whole range of mask possibilities. I think at the absolute base level, we just have to be clear that in Greater Melbourne and Mitchell Shire, when you go out for one of those four reasons, that you have a face covering. It is difficult to interpret as a member of the community different masks, and that's why we have a range of information on the Victorian and health government websites to ensure that people are aware of what masks they can use. But we also have some information on how to make cloth masks. So I'd simply say that there's a range of face coverings available, and that you can always look at the manufacturer's instructions, of course, if you're buying them from places like Bunnings, and that'll give you a significant amount of information too.